Live from our studios on Florida's Suncoast, this is ABC7 News at 5:30. Your Suncoast News.
Well, coming up next, a telescopic eye sounds like science fiction, but it's a medical reality for those who are losing their eyesight. A telescope implant for macular degeneration is now an FDA approved in patients 65 years and older. ABC7's Alex Redmond joins us with this story. Alex.
Thanks, Haley. You may remember the TV show The $6 Million Man. A telescope in his eye allowed him to see what others could not. Now, an implantable telescope for patients suffering from macular degeneration is approved for a wider range of people.
It burns. When it's dry, it's burned. You keep on to put stuff in them all the time.
96-year-old Frances Moeller has macular degeneration.
There's times when it really bothers me.
And she has more than one type of the disease.
Part of this is wet, part's dry.
And it is dry macular degeneration, says Sarasota neuro-ophthalmologist Dr. Mark Levy, that can be treated with an implantable miniature telescope. And now the procedure is FDA approved for patients 65 and more.
It magnifies images 3 times. And as long as it never becomes the wet form, it should do well.
Dr. Levy, the first in Florida to perform the delicate sight-saving surgery at SMH in 2013, describes how the telescope works.
Put a fist in front of your vision of one eye, and you can't see in front of it. But if you now expand that fist all the way to full arm's length, you now can see around it.
Objects are magnified 3 times, and the blind spot is 1/3 the size. Barbara Hewitt of Englewood had the outpatient surgery in February.
Dr. Levy did the surgery. We talked throughout the surgery. And I left and went home after about an hour and a half.
This was Hewitt's vision prior to surgery.
We couldn't see. Just everything went blurry on me.
Hewitt says the telescope acts like a telescope, allowing her to see distance. And this is her vision now.
And you see things that you've not been able to see for a long time.
It takes several months to adapt to the telescope through training. And the implantable telescope is only FDA approved, says Dr. Levy, for use in patients who have not had cataract surgery in that eye, and they have to have 2200 vision. In other words, they have to be legally blind. Back to you.
Thank you, Alex.